In my 15 years of experience as a urologist and andrologist, I have observed how certain topics remain surrounded by taboos in our society, especially when related to the elderly. As a physician trained at Harvard University and a specialist in sexual medicine at the Mayo Clinic in the United States, I consider it essential to address these issues with the seriousness and respect they deserve. Today, I want to share with you a subject that, although natural and healthy, still causes embarrassment for many people: masturbation in the elderly. During my consultations at Massachusetts General Hospital, I often see elderly patients who, after mustering the courage to bring up the topic, reveal their doubts and concerns about the practice of masturbation. Many arrive carrying an unnecessary burden of guilt, influenced by outdated beliefs and misinformation. As a healthcare professional, my role is to demystify these concepts and present evidence-based information. Masturbation is a natural expression of human sexuality, present at all stages of life. In later years, besides providing pleasure and well-being, it brings significant benefits to physical and mental health. Recent studies published in the Journal of Sexual Medicine demonstrate that regular practice contributes to improved blood circulation, strengthening of the pelvic floor, and maintenance of genital health. In my clinical experience, I have observed how patients who maintain an active sexual life, including the practice of masturbation, show better cardiovascular health indicators and a lower incidence of urological problems. For men, regular ejaculation is associated with maintaining prostate health. In women, stimulation helps prevent vaginal atrophy and maintains the trophism of the genital region. During an International Urology Congress in Chicago, where I participated as an invited speaker, impressive data were presented on the neurological benefits of sexual activity in later years. The release of endorphins and other neurotransmitters during orgasm acts as a potent natural analgesic, aiding in the control of chronic pain and improving sleep quality. It is important to emphasize that each person has their own pace and their own needs. There is no ideal or normal frequency for the practice of masturbation. What matters is that it is done comfortably and pleasurably, respecting individual limits. In my consultations, I always stress that self-awareness and respect for one's own body are essential for a healthy sexual life at any age. Many of my patients report that, after overcoming initial embarrassment and understanding the benefits of the practice, they experienced a significant improvement in their quality of life. Mrs. Margaret, a 72-year-old patient, a pseudonym to protect her privacy, shared with me how she felt more energetic and confident after incorporating masturbation into her personal care routine. Aging is a natural process that brings changes to our bodies, but that does not mean we should give up our sexuality. On the contrary, it is a phase of life where we can explore new forms of pleasure and self-discovery, free from the pressures and expectations that often accompany us in youth. As a healthcare professional, I believe it is essential to create a welcoming environment where these issues can be openly discussed. The doctor's office should be a judgment-free space where patients feel safe to express their doubts and concerns. Only then can we contribute to a healthier and more positive view of sexuality in later life. This is just the beginning of our conversation about such an important yet rarely discussed topic. In the upcoming chapters, we will address practical aspects, necessary care, and healthy alternatives for a fulfilling sexual life in later years. Remember, seeking information and taking care of your sexual health knows no age limit. As a specialist in sexual health, I have closely followed the scientific advancements that demonstrate the benefits of masturbation for the health of older adults. In this chapter, we will explore in detail how this natural practice can significantly contribute to the physical and emotional well-being of the elderly, based on solid scientific evidence and recent research. A longitudinal study conducted by Stanford University, following over 30,000 men for 18 years, showed that frequent ejaculation is associated with better prostate health. The results, published in the American Journal of Urology, indicated that men with higher ejaculation frequency had more favorable urological health indices. As a specialist, I can confirm that these findings align with what I observe in my daily clinical practice. For older women, the benefits are equally significant. Regular stimulation of the genital organs promotes increased vascularization in the area, contributing to the maintenance of vaginal trophism and preventing common issues such as dryness and discomfort. In a multi-center study conducted in partnership with the American Urological Association, we observed that sexually active women had a lower incidence of recurrent urinary tract infections. The cardiovascular benefits are also notable. During orgasm, a series of positive physiological changes occur. Heart rate increases moderately. There is peripheral vasodilation, and the release of vasoactive substances that contribute to the health of the circulatory system. Dr. Michael Johnson, a renowned cardiologist at the Cleveland Clinic, with whom I frequently discuss clinical cases, confirms that sexual activity, including masturbation, can be considered a light to moderate cardiovascular exercise. In the neurological field, the findings are equally impressive. The release of endorphins during orgasm acts as a potent natural painkiller. In my clinic, I follow several patients who report significant improvement in chronic pain after incorporating regular masturbation into their routine. A 68-year-old patient, whom I will call Susan, noticed a considerable reduction in joint pain after starting to masturbate regularly. The psychological aspect also deserves attention. The practice of masturbation is associated with the release of oxytocin, known as the well-being hormone, which promotes a sense of relaxation and reduces anxiety levels. In collaboration with the psychiatry department, we developed a study that showed a lower incidence of depressive symptoms in elderly individuals who maintained an active sexual life, including masturbation. During my lectures at international conferences, I always emphasize the importance of demystifying sexuality in later life. At a recent symposium in Boston, I presented data demonstrating how sexual self-awareness contributes to greater self-esteem and improved quality of life in older adults. The response from the international medical community has been extremely positive, recognizing the need to address this topic with more openness. A fundamental aspect I always discuss with my patients is the importance of regularity. Just like any other aspect of health, consistency is more important than intensity. There is no universal ideal frequency. Each person must find their own rhythm, respecting their desires and physical limits. The key is to maintain a regular practice that provides well-being and satisfaction. In my consultations, I often use analogies to facilitate understanding. I compare masturbation to a form of physical exercise for the genitals. Just as we need to keep our bodies moving to preserve muscle and joint health, regular sexual stimulation contributes to maintaining the health of the genital organs and the pelvic floor. It is gratifying to see how modern medicine has advanced in understanding sexuality in older age. Increasingly, scientific evidence confirms what we have already observed in clinical practice. Maintaining an active sex life, including masturbation, is an important component of healthy aging and a better quality of life. As a physician specializing in sexual health, one of my primary concerns is guiding my patients toward healthy alternatives for a satisfying intimate life. In this chapter, we will discuss safe and natural methods to stimulate pleasure in older age, avoiding potentially harmful practices such as excessive consumption of pornographic content. In my clinical experience at Massachusetts General Hospital, I have observed how the indiscriminate use of pornography can negatively impact the sexual health of older adults. During my specialization in the United States, I participated in research that demonstrated how excessive consumption of this type of content can create unrealistic expectations and affect self-esteem. That's why I always guide my patients toward healthier and more natural alternatives. One approach that has shown excellent results is the practice of mindfulness applied to sexuality. This technique, which I learned during my additional training in integrative medicine, involves developing greater bodily and sensory awareness. I have observed remarkable results in my patients who have adopted this practice. A 75-year-old woman, whom I will call Elizabeth, reported significant improvement in her sensitivity and satisfaction after starting to practice mindfulness exercises regularly. Quality erotic literature is another alternative I frequently recommend. Unlike pornographic content, which can be aggressive and unrealistic, well-written literary works stimulate the imagination in a healthy and respectful way. In partnership with sex therapists, we developed a list of literary recommendations appropriate for different patient profiles. It is rewarding to see how many discover a new world of possibilities through reading. Creative visualization and fantasy exercises are also powerful tools. During my consultations, I teach specific techniques to develop this skill. An approach that has proven particularly effective is the creation of positive and realistic mental scripts. These exercises help keep the mind active and stimulated, in addition to contributing to a better connection with one's own body. Conscious breathing is another fundamental element I work on with my patients. Specific breathing techniques can intensify bodily sensations and enhance the experience of pleasure. During a workshop I led at the American Urological Association Congress, I demonstrated how simple breathing exercises can significantly increase sensitivity and body awareness. For couples, I recommend practicing non-genital sensual touch as a way to reconnect with pleasure. This approach, which I learned during my specialization in sexual medicine, has proven to be extremely effective in reclaiming intimacy and sensuality. The focus is not on performance or outcome, but rather on the process of rediscovering one's own body and that of their partner. In my clinic, I also work with music therapy applied to sexual health. Recent studies, some of which I had the opportunity to present at international conferences, show how certain types of music can positively influence mood and receptiveness to pleasure. I developed my own methodology that combines music, breathing, and gentle movement with very promising results. Aromatherapy is another complementary tool I use in my clinical practice. Certain scents have natural relaxing and stimulating properties that can contribute to a more pleasurable experience. In collaboration with specialized pharmacists, we have developed safe protocols for the use of essential oils for different needs. Self-awareness through conscious touch is essential. I guide my patients on proper techniques for self-massage and body exploration, always respecting individual limits and physical conditions. It's inspiring to see how many rediscover sensations and possibilities they thought were lost. Regular practice of specific pelvic floor exercises is also part of my recommendations. During my residency at Massachusetts General Hospital, I developed a special protocol of adapted exercises for the elderly, which has shown significant results in improving sensitivity and muscle tone. These healthy alternatives, when practiced regularly and mindfully, can provide much more satisfying and lasting pleasure experiences than consuming pornographic content. The secret lies in developing a deeper and more respectful relationship with one's own body, recognizing and valuing its needs and possibilities. As a urologist with experience in integrative medicine, I always emphasize to my patients the fundamental importance of nutrition for sexual health. In this chapter, I will share specific knowledge about foods and natural compounds that can significantly contribute to vascular health and, consequently, to a more satisfying intimate life in later years. During my international specialization, I had the opportunity to participate in innovative research on the relationship between nutrition and sexual health. The results were surprising and confirmed something I had already observed in clinical practice. Certain foods have a direct impact on the quality of blood circulation and the health of genital tissues. A particularly interesting discovery was the power of beets for vascular health. This vegetable is rich in natural nitrates, which in the body are converted into nitric oxide, an important vasodilator. In my clinic, I developed a special recipe that combines beets with carrots, rich in beta-carotene and antioxidants, ginger, known for its anti-inflammatory and circulation-stimulating properties, and lemon, which, in addition to vitamin C, The recipe I share with my patients is simple and effective. Process 1 medium beet, 2 carrots, a piece of ginger, approximately 3 milliliters, and the juice of 1 lemon. Some patients prefer to add an apple to naturally sweeten it. This combination, when consumed regularly, has shown impressive results in improving blood circulation. During an international symposium on integrative medicine in Chicago, I presented a case study involving 50 patients who adopted this regimen into their daily routine. After 3 months of regular consumption, 80% reported significant improvement. in overall energy levels and the quality of erections. Among the women, there were reports of increased sensitivity and natural lubrication. In addition to this specific regimen, I advise my patients on the importance of a diet rich in flavonoids, compounds found in berries, dark chocolate, and green tea. Studies conducted at Harvard University have shown that these compounds have positive effects on cardiovascular health and consequently on sexual function. Nuts also deserve special attention. Walnuts, chestnuts, and almonds are rich in L-arginine, an amino acid precursor to nitric oxide. During my consultations, I always recommend the daily consumption of a portion of mixed nuts, preferably without salt. A 70-year-old patient, whom I will call John, reported significant improvement in his energy levels after incorporating this habit into his routine. Another important aspect I address is proper hydration. Many elderly individuals tend to reduce their fluid intake, fearing bladder issues. However, I explain that hydration is crucial for vascular health and the overall proper functioning of the body. I have developed a special technique of scheduled hydration, which allows for adequate fluid intake without compromising nighttime sleep. Spices also play an important role. Cinnamon, cardamom, and black pepper are known for their circulation-stimulating properties. In collaboration with specialized nutritionists, I have developed recipes that incorporate these spices in a flavorful and senior-friendly way. Regular consumption of omega-3 rich fish, such as sardines and salmon, is also part of my recommendations. These essential fatty acids are crucial for cardiovascular health and proper hormone production. During my residency, I participated in a study that demonstrated the benefits of regular omega-3 intake on the sexual health of seniors. It is important to emphasize that all these nutritional recommendations should be tailored to the individual conditions of each patient. During consultations, I always check for potential interactions with medications and pre-existing conditions. Personalization is essential to ensure not only the effectiveness, but also the safety of nutritional interventions. As a specialist in sexual health, I know that theory without practice has little value. In this chapter, I will share practical and effective strategies to implement the changes we discussed in previous chapters, based on real success cases I have followed throughout my career at Massachusetts General Hospital and in my private practice. Implementing new habits requires a gradual and consistent approach. During my specialization in the United States, I participated in research on behavioral change that demonstrated how small daily adjustments are more effective than abrupt, large changes. For this reason, I developed a special adaptation protocol that has shown excellent results with my elderly patients. The first step is to establish a self-care routine. I suggest starting with 10 minutes daily dedicated exclusively to body self-awareness. This moment should be treated with the same importance we give to other aspects of health, such as taking medication or exercising. A 68-year-old patient, whom I will call Patricia, reported that establishing this daily moment was transformative for her self-esteem and overall well-being. To facilitate implementation, I developed a wellness journal that I provide to my patients. In it, they can record their sensations, discoveries, and progress. This record not only aids in medical follow-up, but also increases awareness of their own body and its responses. During an international conference on sexual medicine in New York, I presented the positive results of this approach. The organization of the environment is also crucial. I advise my patients to create a suitable space for their intimate moments. This can include simple adjustments like a comfortable temperature, appropriate lighting, and the use of comfortable fabrics. A 73-year-old gentleman, whom I will call Robert, shared how reorganizing his bedroom, following these guidelines, significantly enhanced his self-care experience. Another important aspect is the integration of mindfulness practices into daily life. We developed a program of simple exercises that can be done at different times, during a shower, upon waking, or before sleeping. The flexibility of the program allows each person to find the most suitable times for their routine, increasing the chances of adopting the new habit. For those who choose to practice erotic reading, I suggest a progressive reading schedule. Start with lighter, more romantic texts. gradually advancing as individual comfort allows. A curated virtual library, which I developed in partnership with sexual therapists, offers suitable options for different profiles and preferences. The implementation of dietary changes also follows a gradual approach. The natural recipe we mentioned in the previous chapter, for example, can initially be introduced twice a week, increasing the frequency as adaptation occurs. I provide patients with a detailed weekly plan, including alternatives for different tastes and nutritional needs. Breathing exercises and pelvic floor strengthening can be incorporated at specific times of the day. During my consultations, I teach techniques that can be practiced discreetly, even during everyday activities like watching television or taking a walk. Consistency is more important than intensity. For couples, I suggest implementing a daily connection ritual. It can be something as simple as 5 minutes of non-sexual touch before bed. During my residency, I conducted a study that demonstrated how these small moments of connection can significantly strengthen a couple's intimacy. Regular follow-up is crucial in this process of change. In addition to in-person consultations, I stay in touch with my patients through a support group I created, where specialized professionals offer ongoing support. This close follow-up allows for personalized adjustments to the program and significantly increases success rates. Technology can be a valuable ally in this process. In collaboration with a team of programmers, I developed an app that helps with tracking and monitoring new practices. The app includes personalized reminders, daily tips, and a progress tracking system, all with an interface specially designed for older adults. Throughout my journey as a specialist in sexual health, I have witnessed extraordinary transformations in the lives of my elderly patients. In this final chapter, I want to share important reflections on how an integrative approach to sexuality can revolutionize our understanding of healthy aging. In 15 years of clinical practice, I have observed how society often underestimates the importance of sexual life in later years. During my international specialization, I had access to studies that demonstrate how cultures that value the sexuality of the elderly show higher rates of quality of life and longevity. This broader and more inclusive perspective has guided my medical practice. One of the most rewarding aspects of my work is observing how self-awareness and care for sexual health can positively impact other areas of life. A 77-year-old patient, whom I will call Dorothy, after implementing the practices we discussed in previous chapters, reported significant improvement in her overall energy, sleep, and family relationships. During an international symposium on healthy aging in Los Angeles, I presented data demonstrating how maintaining an active sexual life, including the practice of masturbation, is correlated with lower incidence of depression and anxiety in older adults. These results reinforce the importance of a holistic approach to elderly health. The integration between sexual health and overall well-being has been the subject of several studies I conducted at Massachusetts General Hospital. We observed that patients who maintain an active sexual life, whether through self-stimulation or with partners, show better adherence to other medical treatments and greater engagement in social activities. A fundamental aspect I always emphasize is the importance of family support. When the family understands and respects the sexuality of the elderly, the process of self-care becomes much more natural and effective. During my lectures for patients, families, I share strategies to create an environment of respect and understanding. The experience with support groups has been particularly enriching. We have created safe spaces where the elderly can share experiences and lessons, always under the supervision of qualified professionals. The sense of community that develops in these groups has a profound impact on the self-esteem and overall well-being of the participants. The changes I observe in my patients go far beyond the physical aspect. A deeper connection with their own body and sexuality often leads to a broader awakening. Many discover new interests, revisit old hobbies, and develop a more positive attitude toward life. In collaboration with gerontologists and psychologists, we have developed a monitoring program that tracks various aspects of quality of life. The results are impressive. Patients who adopt a positive approach to their sexuality show better outcomes in nearly all evaluated parameters. Social transformation is also a crucial part of this process. As healthcare professionals, we have a responsibility to educate and raise awareness in society about the importance of sexuality in later life. In my appearances on television and radio programs, I always strive to demystify prejudices and share information based on scientific evidence. The future of sexual medicine for the elderly is promising. New research and technologies are constantly emerging, expanding our possibilities for intervention and care. However, the most important thing remains the shift in mindset. Understanding that sexuality is a fundamental aspect of health at every stage of life. To conclude, I would like to emphasize that each person has their own path and their own timing. What matters is staying open to possibilities, seeking quality information, and, most importantly, respecting your own limits and desires. As a physician, my role is to offer support and guidance on this journey of self-discovery and well-being.